Just do it, 'cause it's all about the audio anyway.
Okay,
So
but let
it's
me
fine.
think about it for a second. Like I think you can just go. We're having a podcast with people passing around. That's the beauty of the podcast.
Right, so you can go past. It's all good. It's all
people
good.
passing is
It's
part of
it's global perspectives on digital health. We are doing hot takes at health. What a lovely background we have, and we've got Jhonatan. What is your hot take?
All right, so I'm Jhonatan, CEO of Lapsi Health and Keikku. So my hot take is we have seen billions of dollars being invested into companies in the last couple of years. Where are the maternal and pediatric health companies? Where are they? I can't see them. I only see LLMs, and LLMs. I would really love to see a little bit of pediatric innovation, a little bit of maternal health innovation. So that's my hot take.
Okay, so let's get into this. I mean, I guess it depends where you look. There might be some examples in the pre-LLM era of like machine learning, and the child health and pediatric health space suffered from availability bias, right? But like in the kind of new era of generative AI, perhaps there are examples of tools where parents are the end user and seeking health information or decision making for their kids. Are you not seeing that?
Yeah, but that is a consequence of the LLM era, right? And it is it's still targeted to the adults, right? But what I'm seeing in the pediatric space is that if you ask an LLM a question about a disease, it won't even ask you if the patient is a child or an adult. It will assume that it's an adult, and that is biased. And why is there that bias? Is because we just don't generate enough information on pediatrics at all, right? Neither on women healthcare. I was talking to a scientist in London a couple of months ago at a conference, and he was like, I am one of the first scientists in the world to study breast milk. And before me, when I went and I had to actually look into the base of, which studies in literature can I refer myself to when I am doing an investigation on breast milk, cow milk. That was the only thing he could find information from. And that is embarrassing. It's absurd for, the development of science and technology that we are seeing right now, and then seeing these tremendous biases in pediatric and maternal health that are just absolutely crazy, and women health in general.
So in terms of my experience and like what we do with the podcast in like low resource settings, like I definitely see examples of I guess like innovations towards young people, children, and maternal and child health outcomes. But it's true that like, I guess like what you're talking about here is like, I guess like a child as their end user. I'm kind of trying to think about the second and third order effects of like someone who might be like, I want to build a tool in this space.
Let me give you an example of this.
Yeah.
Okay. 1.75 million stillbirths annually. Do we have any innovation in the world that can prevent the stillbirth? No. These are babies that are alive in the womb, and they die for causes like the umbilical cord, around the neck, or a complication from a disease that happened during pregnancy. That if we would have the technology, to be able to automate cars and drones, we should have the technology to be able to prevent stillbirths. It is inconceivable that we are not generating resources or generate simple solutions to fight these types of diseases and types of outcomes.
So what needs to happen? Like, I'm sure it's not through a lack of people seeing that there's problems need to be solved in these spaces.
Well, I think that that what we need to do is we need to start to innovate more in the sensor component parts. Start to generate new types of medical devices that have these flexibility, malleability to obtain signal information and to be able to generate and think and compute on data sets that are built for the specific population.
I think like availability of this population of data. I mean, I guess what you're saying is like children themselves and, infants and children are themselves underserved and underrepresented.
And under-researched completely. Yes. And let me give you one more thing.
Mm-hmm.
We obsessed in the last decade to treat chronic diseases. And if you look into the innovation landscape for the last 5 to 10 years, the most important innovations that were delivered, developed, and funded were heart failure and COPD. Both diseases in the geriatric population. I'm going to give you a hot take. If you treat
another one,
yes, this is the hottest take. Treat an infant in the first 10 years of their lives, they decrease the chances of generating these chronic diseases when they are old adults
If you're thinking about a lever point
by
for
more than 50%.
yeah, for impact, yeah, long term.
So if we're talking about sustainability and innovation, and we're actually looking into those types of diseases, we might as well just start treating at the beginning. It's obvious, you know, if you have a good maintenance in your car, you're not going to have so many issues when it arrives to 100,000 kilometers. It's just the way it goes.
I like it. Thank you. Awesome.
Thanks.